Well, more than 1.2 million COVID-19 tests have been carried out in South Africa so far. President Cyril Ramaphosa has emphasized that government will increase screening and testing across the country. Well, Prof. Adrian Purin from the National Institute for Communicable Diseases joining us here for our daily chat. And Prof, a very good morning to you. Let's look specifically this morning at the testing process. And when it comes to specimen sources, if we actually look at data, they are divided or broken up into passive case finding and community screen and test. Just explain the difference for us and why it's important.
Yeah, so that's very important because if you recall, with the lockdown, there was a marked expansion in terms of community screening. In other words, there were community health workers who went through various communities to identify individuals with symptoms and have them tested. That was the large program, as you recall. But over time, this has actually declined or decreased. And of course, the utility of this program was not always clear. It certainly identified individuals, but also in relationship to the resources that were required for testing. This also became somewhat onerous, and we also had the large backlogs, as you noted. The passive testing is really where individuals who may experience symptoms, for example, the key symptoms that are used for identifying possible cases, as well as possibly asymptomatic people actually presenting to facilities or to hospitals to have themselves tested. And as you can see, with the announcements that, in fact, the actual community-based screening has certainly declined. It's about, I think, 25% or thereabouts, whereas the passive, in other words, presentations to hospitals or clinics or to facilities, has certainly increased to about 75% on that.
So what's that done in the figures that we actually finally see? Like every morning we're giving people, the number of positive cases, the number that have been tested. So how do we actually, for the layman, actually, what do we read into what we're seeing there, especially on our screens at the moment?
Yes, I think it comes back to the point of what we want to emphasize and where we want to focus the testing. I think the emphasis is still around the key populations that we need to identify. For example, healthcare workers that need to be tested if there are exposures, for example, or presentations of symptoms. We've noted deaths in that particular group, and we've certainly noted a proportion of individuals that have become symptomatic. I think it's about 3% of the total populations, but I don't have the exact figures yet.
Yeah.
No, obviously the hospitalized patients, I think those are the key ones that are presenting with symptoms, either to the hospitals or within the hospitals, who need to be tested. And I think the other groups that need to be tested are those that are vulnerable, in other words, that are in prisons, for example, frail care, those types of scenarios where there are possible asymptomatic exposures and or symptomatic exposures that actually need to be tested. I think that's where the key focus needs to be with regard to testing.
And if I look at the graph that comes through on this, the community testing data by date specimen that we're talking about, and we look at passive case finding and then community screen and test, and looking at just where passive case finding actually soars as we come, and we're just looking at from the beginning to the end of May here, for example. What does that tell us there? I mean, we're looking at the red and the yellow, the red being a passive case finding.
Yeah, in fact, that probably is a reflection of greater spread within our communities, in fact. And as you can see, there are deflections both in the Eastern Cape and more so in the Gauteng region, in fact, that we can actually see a greater increase in the numbers of cases. And I think those are the sources of those particular infections and the data that we're seeing.
So in light of what we're seeing on these graphs and tables, and we had government saying, the health minister saying, yes, now we're not just going to continue with just mass testing of communities, that now we're actually just going to concentrate a lot more on those hotspots where we are seeing the spreading like wildfire. Now, are we likely to see a difference in these figures in the coming months due to that?
Yeah, I think the other challenge that I think we are probably experiencing is obviously the backlogs that we've certainly seen, and that relates to the reagents, in other words. So if we want to expand the testing, which I think we need to do, because in fact our positivity rate is between 5 and 10%, we really need to expand the testing. But how do we do that? And in terms of the context of limited reagents and resources to achieve that, to give us a better sense. So we may have to look at other data sources, in fact, look at our mortality data to get a better sense of what this epidemic looks like.
Okay, I think we'll leave it there for now. Thanks very much there, the NICD's Professor Adrian Purin, just making sense of some figures and testing methods and changes in noted in specimen sources there, and who we're testing when it comes to COVID-19.